This hand washing station is just one of several supplies available to health and medical agencies. It's practical equipment like this that can really make a difference during an emergency or crisis.
What resources do we have available? How do we access them? And how do we use them?
About 80 first responders and caregivers came to learn about what is available to them in case of an emergency. One example given was when the drinking water in Panguitch was contaminated after runoff resulting from the Bryan Head fire. The health department activated its water purification system.
We have 2 big units like this in our region. The output is 750 gallons an hour. So Garfield Memorial was up without water for 6 days. They didn't have to evacuate or anything. They were able to maintain all services with our support.
I was involved with the Panguitch water outage and helping to set up those purification units. And those could be needed in so many situations.
Along with ham radio operators, the department also has radios and other forms of communications that are available.
Multiple different communication methods that we can reach out to you, and that in an emergency, if we don't have cell phone, if we don't have email, whatever it may be, that we are able to communicate back and forth.
In the case of a pandemic, isolation may be needed to avoid communicable diseases. These isopods are also in stock.
Most of the coalitions across the state have isopod units. There's one in Richfield, there's one in Price.
It's all about being prepared by stocking up on supplies, especially for those who can't help themselves.
To make sure that we're thinking ahead of what people would need in an emergency and what we can do to help those with extra needs to prepare for emergencies and disasters.
Most of this equipment could be used in a medical shelter or to shelter in place. It's about knowing what equipment and resources are available to those in the healthcare industry and who is there to help others.
I think having the buddy system was probably the most important thing that we were talked about, where it's creating relationships with family members or even neighbors to know that they're not alone if there is an emergency.
In all health-related disasters and emergencies, the equipment must be requested after local sources are depleted. It usually comes with a declaration of an emergency by the county.
You know, you would hate someone to lose their life or not be have the access to the medical needs that they need in the event of an emergency, especially if it's available.
The key is to always be prepared.
If this happened, what would you do at your facility, or what would you do in your agency? And then these are the things that we have available to assist you.
And I think it opened the eyes of a lot of people where they now know that there are resources there that they can call upon in an emergency that prior to this they didn't know were there.
I feel like we could take care of patients if we do need it. I think that people don't realize what home health and hospice can do.
But perhaps the real heroes here are those caregivers and first responders who are prepared to help.
We've done Stop the Bleed, we've done some CPR, we've done QPR training, which is suicide prevention. We've had a lot of great events. We've got some great volunteers.
Everything that we do is for free. We get our money from corporate sponsors as well as private entities. So if we help you guys in a disaster situation, it is no cost to your organizations.
So kudos to all of you for your efforts. I feel comfortable in saying that the Southwest region is as prepared as any in the state, and probably in many cases more prepared than areas of the state.
While today's gathering was just for those in Washington County, it will soon be extended.
We are doing this very same drill in every county. We're doing 6 of these drills within the next 3 weeks.
In Washington County, Melissa Anderson, Community Education News.